Remember the eerie silence that fell upon our world in early 2020? Bustling streets stood empty. Our once familiar routines of work, school, and social gatherings vanished overnight. The COVID-19 pandemic swept across the globe, leaving an indelible mark on every aspect of our lives. It was a time of fear and uncertainty, but also a time of profound reflection and change. We watched in disbelief as hospitals overflowed and countries closed their borders. The world seemed to hold its breath, united in a shared experience that transcended borders, languages, and cultures. We were forced to confront our vulnerability, our interconnectedness, and the fragility of life itself. This global crisis challenged our assumptions about the world and our place in it. We learned to adapt, to find new ways to connect, and to appreciate the simple things we often took for granted. The world as we knew it had changed, perhaps forever. But amidst the loss and uncertainty, there was also hope, resilience, and an extraordinary capacity for human connection. The pandemic became a catalyst for change, accelerating trends that were already underway. It forced us to rethink the way we work, the way we learn, and the way we care for ourselves and each other. In the face of adversity, we discovered hidden strengths, forged deeper connections, and found new ways to thrive. Remember the daily commute? The crowded trains, the traffic jams, the endless search for parking? For many, the pandemic brought an end to this daily grind. Working from home, once a perk for a select few, became the new normal for millions. This shift to remote work was dramatic and swift. Companies of all sizes had to adapt quickly, embracing video conferencing, cloud-based collaboration tools, and flexible work arrangements. Employees traded in their office desks for kitchen tables, their morning commutes for walks around the block. This newfound flexibility was a welcome change for many, offering a better work-life balance and more time with family. But it also blurred the lines between work and home life, leading to longer work hours and feelings of isolation for some. The mass adoption of remote work also had a profound impact on the labor market. Employees gained leverage as companies competed for talent in a geographically expanded pool. The Great Resignation saw millions quitting their jobs in search of better pay, greater flexibility, and more fulfilling work. The pandemic accelerated our reliance on technology in every aspect of our lives. Remember those early days of Zoom calls when we were all figuring out the mute button and the best lighting? Video conferencing became our lifeline to the outside world, connecting us with colleagues, friends, and family. We attended virtual weddings, funerals, and birthday parties, finding ways to celebrate milestones and offer support from afar. The pandemic also fueled a surge in online learning. Schools and universities transitioned to remote learning platforms, forcing teachers and students alike to adapt to a new way of teaching and learning. While online learning presented challenges, it also created opportunities for personalized education and expanded access to knowledge. The healthcare industry also underwent a digital transformation. Telehealth appointments became increasingly common, allowing patients to consult with doctors remotely and access healthcare services from the comfort of their homes. This proved particularly crucial for those in rural areas or with limited mobility. While the pandemic accelerated technological innovation, it also took a toll on our mental health. Lockdowns and social distancing measures, while necessary to slow the spread of the virus, led to widespread isolation and loneliness. The absence of physical touch, social interaction, and our usual routines had a profound impact on our well-being. Rates of anxiety, depression, and substance abuse rose sharply as people struggled to cope with the uncertainty, fear, and grief brought on by the pandemic. The mental health crisis highlighted the importance of human connection and the need for greater investment in mental health services. It also sparked a conversation about the importance of self-care, mindfulness, and seeking help when needed. The shared experience of the pandemic also fostered a sense of empathy and compassion. We learned to appreciate the importance of social connection, the value of our relationships, and the simple joys of human interaction. Amidst the challenges and hardships, the pandemic also brought about some unexpected silver linings. With more time at home, many people, rediscovered the pleasures of cooking, gardening, reading, and spending time in nature. Families found new ways to connect, playing board games, sharing meals, and simply enjoying each other's company. The slower pace of life allowed for reflection, self-discovery, and a renewed appreciation for the simple things. The pandemic also sparked a wave of creativity and innovation. Musicians held virtual concerts, artists shared their work online, and writers found inspiration in the extraordinary circumstances of the time. The crisis forced us to think outside the box, to adapt, and to find new ways to connect and create. The importance of community and social responsibility was also brought to the forefront. Neighbors helped neighbors, volunteers delivered groceries to the elderly, and healthcare workers were hailed as heroes. The pandemic reminded us of our shared humanity and the importance of looking out for one another. The pandemic exposed and honestly, really exacerbated existing inequalities around the world. Access to healthcare, technology, and economic opportunity varied dramatically, both within and between countries. The development and distribution of vaccines highlighted the vast disparities in global health. While wealthy nations secured early access to vaccines, many developing countries struggled to obtain even basic medical supplies. The economic fallout from the pandemic hit marginalized communities the hardest. Job losses were concentrated in low-wage sectors, disproportionately affecting women, people of color, and those without a college degree. The pandemic also underscored the digital divide, as those without access to reliable internet or digital devices struggled to adapt to remote work, online learning, and telehealth services. This lack of access further exacerbated existing inequalities in education, healthcare, and economic opportunity. The pandemic tested our trust in institutions, including science and government. While scientists raced to understand the virus and develop vaccines, misinformation and conspiracy theories spread rapidly online. The politicization of the pandemic further eroded trust in public health guidance, as mask wearing, social distancing, and vaccination became entangled in partisan divides. This erosion of trust had real-world consequences, hindering efforts to control the spread of the virus and protect vulnerable populations. The pandemic highlighted the importance of scientific literacy, critical thinking, and the ability to discern credible information from misinformation. It also underscored the need for clear, consistent, and evidence-based communication from public health officials and government leaders. The COVID-19 pandemic was a global crisis unlike any other in our lifetime. It forced us to confront uncomfortable truths about ourselves, our societies, and our world. But it also revealed our resilience, our capacity for compassion, and our ability to adapt and innovate in the face of adversity. We learned the importance of community, the value of human connection, and the fragility of life itself. We gained a newfound appreciation for the simple things, the importance of self-care, and the need to prioritize our mental and physical well-being. The pandemic also served as a wake-up call, exposing the deep inequalities that exist in our world and the urgent need to address them. It highlighted the importance of investing in public health, strengthening social safety nets, and creating a more just and equitable society for all. As we emerge from the shadow of the pandemic, we have a unique opportunity to build a better future. By embracing the lessons learned, we can create a world that is more resilient, more equitable, and more compassionate. We can harness the power of technology to bridge divides, improve access to education and healthcare, and create new opportunities for economic empowerment. We can invest in mental health services, strengthen social safety nets, and build more inclusive and supportive communities. We can prioritize sustainability, reduce our environmental impact, and work together to address the challenges of climate change. And we can recommit ourselves to the values of empathy, compassion, and social responsibility, recognizing our interconnectedness and working together to create a brighter future for all. The COVID-19 pandemic was a defining moment in human history. It tested us, challenged us, and changed us forever. But it also reminded us of our shared humanity, our resilience, and our capacity for hope. By learning from the past and embracing the future with courage, compassion, and innovation, we can create a world that is healthier, more just, and more sustainable for generations to come.